Ian Yates, welcome to News 24. If I could ask you first, who your organisation represents? Do you have members? If so, how many?
The Councils on the Ageing around Australia, which COTA Australia is the peak body, have well over 1,000 organisational members who represent seniors from all walks of life. Plus we have over 40,000 individual members around the country. So we reach out really to close on 500,000 older people, predominantly people in their 60s, 70s, 80s around Australia.
How critical do you think it is to get some substantial aged care reform?
This is really critical time. The 2012 budget is really crunch time for aged care reform. The current system's been having difficulties for a while, but it's going to really start to be challenged, or in fact it's going to start failing older Australians if we don't see a clear commitment to reform next year, and steps being taken almost immediately to start addressing the changes we need.
Where are the shortcomings in the system? Where are the areas that are in most serious need of change?
There's a whole mix of areas, but let's say that what we need is an aged care system that actually gives much more support and care for people in their own homes and in community, and the current system's run out of capacity to do that the way it's structured. We need a system that's much more person-focused, much more focused around the needs of the individual, and the current system is very provider-focused. We also need a system that's financially sustainable and stable, and this one isn't. So really all those things are coming together in a way that means the current one's going to start to be broken, and we need the new one in place quickly.
The debate on aged care usually centres around residential care, but from what you've said, is it actually more important to allow people to stay in their own homes for as long as possible?
One of the unfortunate things is that people in Australia hear the words aged care and think nursing homes. In fact, a minority of people receiving support and care, older people receiving support and care in our country, get that in residential care. The majority are cared for now in their homes, often at a low level, but often now at quite high levels of care. And that's the overwhelming preference of people, that there should be support and care in their home, in their community, that enables them to keep contributing, to keep being members of their families and their community. And we can do an awful lot more with that if we change the system. We know how to do it. There are challenges, but we know how to do it. And so residential care will always be a need. It will always be important for certain types of older people, but the real crux of the matter is to beef up home and community care.
So residential care, in effect, should be the last resort?
Residential care should be something that people go to when it's clinically appropriate, or when people are very frail and unable to continue to be cared for in the community, either clinically or because of the cost, and we have to see that as a realistic issue. But at the moment what we have is far too many people going into residential care because the community care isn't there, and that's not a good reason for doing it.
And what sort of changes would be needed to improve, to expand the levels of community care?
The first thing we need, which is recommended by the Commission in its draft report, and we're sure it'll be in the final report, is to separate out the funding streams for care and accommodation, and to say to people, you can receive an entitlement to a bundle of resources based on an assessment, based on a Commonwealth approved assessment, that you can use where you want to. So you actually have the ownership of this. It's not like beds being given to providers. It's you being given an entitlement to a percentage to a proportion of care that you can use in your own home, you can use in a new setting, or you can use in a residential setting if you need to.
There was quite a bit of debate in the 90s when the Howard government first tried to introduce accommodation bonds. Do you think there is a different attitude now to having people who can afford to contribute to the cost of their own care doing so?
I think we separate out the two things. First is that in Australia we're used to looking after our own accommodations through most of our lives with a safety net of public and social housing. And those safety nets also need to be beefed up in this country now, but People are used to looking after their own accommodation, and what we will see, we think, in the post-Productivity Commission era is people having a much greater choice of later years housing. At the moment, essentially, it's either residential care or it's retirement villages, although most people live still in their own independent housing in the community. But I think we'll see much more imaginative approaches to seniors housing. Then if people have their own care packages that they can take, they can negotiate for them to be in any of those settings. People contribute to care costs. Well, the Commission will be recommending that they contribute to them according to a means test. And in Australia, we are used to means testing things, and I think that people will accept means testing, continuation of means testing in aged care, provided that they see that they're getting a high quality service, that they're getting it promptly, that they have choice, then they're prepared to pay in a fair way. At the moment, the user contribution system in aged care around Australia is haphazard, doesn't deliver you always high quality care, so people are grumpy about it. But the debate got off to the wrong tack last time, and what people are really focused in is what kind of quality of care am I getting, and is the contribution I have to make to that fair?
Finally, any change is likely to be a significant one and involve many areas of the government, because it'll cover the health system, the pensions and retirement income system, looking at workforce issues. Do you think the government, from what you've heard, is committed to this change, and do you think it needs bipartisan support from the opposition?
Well, you make a really good point, Lyndall, because we need to see this as not just about aged care as we've narrowly seen it, but about the continuing contribution of older Australians in the community, even people who are frail and with illnesses. So we've been heartened that the government has not only had the Productivity Commission inquiry, but it has an initiative called the Panel on the Economic Contribution of Senior Australians, which is working away now, and we're working with them, looking at all the various ways those public policy instruments feed into supporting the role of older people as contributors, not just seeing them as dependents in our community. So yes, we need a whole of government commitment to this change and to the connectedness. I think we're very confident that the government will honour its commitment. The Prime Minister has said that this is a reform agenda for this term. The Senior Minister, Nicola Roxon, has been very supportive, and Minister Mark Butler has already demonstrated in mental health his credentials, and his personal commitment to reform in aged care is well known. We've been talking vigorously to the opposition and to the Greens and the crossbenchers, and our impression is that there's a great deal of recognition that this kind of reform, recommended not by some government backroom arrangement, but by the Productivity Commission, is good, sensible public policy, that it needs bipartisan support, and it certainly needs time to be aired and debated in the community in a sensible way, and we would expect all parties to be part of that.
Ian Yates, thank you very much for your time.
It's a pleasure, Linda.